Tēnā koutou katoa. I'm Caroline McElnay and I'm Director of Public Health at the Ministry of Health. I want to just firstly read a short statement and then I'm happy to take questions. Thank you. The Ministry of Health is saddened to report 2 further deaths linked to COVID-19. The families of both people will be in the country's thoughts at this very difficult time, and we extend our sympathy to them. All families need time to grieve, and we ask that their privacy continues to be respected. New Zealand now has 4 deaths associated with COVID-19. As we have said previously, this can be a very serious disease, particularly for elderly people and also for those with underlying health conditions. What we can say about the 2 cases we are reporting on today is that both deaths have occurred in older individuals with underlying health conditions. Both can also be linked to existing COVID-19 clusters. The first individual is a man in his 80s who died at Wellington Public Hospital yesterday. This gentleman had a link to an established cluster. To allow his family more time to grieve, we will not be identifying that cluster today. We can say that he first became unwell on the 26th of March. He was admitted to Wellington Hospital on the 28th of March and has been there under care ever since. We are confident that his close contacts have all been traced and that there is no additional risk posed by this very sad death. The second individual is a man in his 70s who died at Rosewood Hospital in Christchurch yesterday. As with the death we reported on yesterday, this gentleman was one of a group of 20 residents transferred from Rosewood Rest Home and Hospital to Burwood as part of the Canterbury District Health Board's cluster management process. These residents were relocated to a ward at Burwood to allow them to be managed in one location, but in isolation from each other. This gentleman was tested on the 9th of April and subsequently returned a positive result for COVID-19. Due to the underlying vulnerabilities of this group, we cannot rule out further serious illness or deaths within it. We acknowledge the anxiety New Zealanders may be feeling about today's news, both in the wider community and also for family and whānau grieving over these sad deaths. And because of the current level 4 alert, we also know it can be difficult for families to feel that they're part of their loved ones' final hours. On behalf of all New Zealanders, the Ministry wants to sincerely thank frontline health staff who are also providing patients with comfort and support during these times. Again, today's news reinforces the importance of our move to alert level 4 and the measures we are all taking to limit spread, break the chain of transmission and prevent deaths. We want you to know that our health system will continue to do everything it can to support the fight against COVID-19. I just want to give you an update on the numbers for today. So today there are 29 new cases of COVID-19 to report, made up of 20 new confirmed cases and 9 new probable cases. As I've mentioned, there have been 2 additional deaths to report for a total of 4. There are now 422 reported cases who have recovered from COVID-19, an increase of 49 on yesterday. And we continue to report more people recovered than new combined cases. So the total combined confirmed and probable cases in New Zealand is 1,312. Today there are 15 people in hospital. That includes 5 in ICU, 1 each in Wellington, Middlemore, Hawke's Bay, Dunedin and North Shore. One of these ICU patients in Dunedin is in a critical condition. For those cases we have information on, we are still seeing a clear but declining link to overseas travel at 40%, with ongoing links to confirmed cases within New Zealand, 46%, including those in clusters we already know about and community transmission at 2%. We are still investigating 11% of cases. In terms of testing, yesterday we carried out 3,061 tests with a rolling 7-day average of 3,619 and our total tests to date of 58,746. I just want to say a few words about clusters because we at the Ministry have a focus on clusters and we know that there's significant public interest in our management of them. And as I've stated earlier, 3 of the 4 deaths to date are linked to clusters. There are 13 significant clusters across New Zealand as of today, and our 3 largest clusters remain Matamata with 70 cases, Bluff with 85, and Marist College with 85. Although we've given those names to those clusters, I just want to reiterate that we see cases across the country, and those names do not necessarily mean that those cases are all in those places. The new cluster is an aged residential care facility in Christchurch known as the George Manning. Additionally, 2 of our larger Auckland clusters, which we have not previously named, we can now provide some additional information about. They are already on our website, but the first is an outbreak in the community which has subsequently resulted in cases at a Spectrum daycare facility, providing daycare to individuals with an intellectual disability. And the second cluster is linked to a private party to celebrate an event in Auckland. There have been 35 cases linked to this cluster. Thank you. I'm happy to take any questions.
What can you tell us about the residents at Rosewood that have been transferred, or any other measures that are being made to contain or manage that particular cluster?
So at Rosewood, I'm able to report that there are 30 cases there who have been identified. That's a combination of both confirmed and probable. And that is made up of 13 residents and 18 staff, plus 2 other cases who are connected through close contact. The 20 from Rosewood who were moved to Burwood are in Burwood, and further investigation has been underway for the other staff at Rosewood to make sure that they are well. They have been tested. I have received no information that any of those have tested positive. They remain well.
What can you say to the families? You know, obviously with lockdown conditions, people can't get in to see their loved ones. What can you tell families about the management of that if they have loved ones in these facilities and they're concerned about what's happening?
I totally sympathise with the concern that families would have at this time. I think it's obviously very concerning for them. I would ask local family members to direct their inquiries direct to the DHB, and they can tell them exactly what's happening in terms of their family members. What we needed to do, or what Canterbury needed to do, was to because of the cases in staff, was to put those staff into isolation, and that's resulted in management system having to be put in place to look after the remaining residents.
Give us an update into the investigation as to how COVID-19 got into Rosewood in the first place?
Those investigations are still ongoing. I've spoken to the Medical Officer of Health in Canterbury there today, and they're still doing further testing to see if they can identify how this infection came to be at Rosewood.
Are you confident you made the right decision in moving them from the rest home to the hospital, given that we've now seen several deaths, or 2 deaths there?
So yes, the Canterbury District Health Board did make the right decision in moving those people to Burwood. These are a group of frail individuals who did need ongoing support. They were moved as a group, but kept in isolation so that they were not kept together, but they needed that extra level of support at Burwood.
Is
But
More that you can tell us about the new cluster in Christchurch, the George Manor?
so the George Manning is a cluster that has been cases have been reported for a few days. I do have some numbers that I can give you. We've got 14 cases there who are confirmed and probable. They are a mixture of residents and staff. That's really all the information that I have at the moment. My understanding is that that is a cluster that is well contained, is not continuing to increase.
Can you talk to how quickly this virus moves for elderly people like the people at Rosewood? Because the man that died, he wasn't being named as critical yesterday, was he?
I think with the group that we have at Rosewood, they are a group of frail elderly people, and what we're seeing sadly in New Zealand, but also what we have seen overseas, is the impact that COVID-19 particularly has on that very frail and vulnerable group. I have been assured today that all the residents who were moved to Burwood are, whilst they're frail and they're not well, they're being managed and given the best possible care. But we just want to acknowledge that COVID-19 for this age group and for people with significant underlying conditions can be a very unpleasant illness, and sadly we do know that people can die from it.
Do you have a date for the new cluster in Auckland, the private function?
The private function again is a function that has been reported, I think, previously on our website, and it has 35 cases confirmed and probable. I think what we're seeing with these private functions, and we see that particularly with the Bluff wedding function, is that social events like weddings, like parties, and other social events really act as a mixing bowl for this infection to be spread. And we're seeing that. We're seeing that in New Zealand. We're seeing that in other parts of the world as well.
This is an outbreak that had come up earlier, so there's no suggestion that this was a function sort of into the lockdown or people getting together.
This is one that we knew about.
It's just developed.
Yeah, this is just because with that particular one, there is ongoing transmission happening from some of the people who were at the function. So a number of people who were infected at the function, then that infection has passed within their household bubbles during the lockdown, but the function was well in advance of any lockdown happening.
Any more details about what the function was? Was it a sort of private birthday party among family? Was it a work function, or any other details around the function at all? Because that's still quite broad.
Yeah, all I can say is it was a private function. It wasn't a workplace function. It was a private social event.
Residents, are they counted within the number of people with COVID in hospitals? And if they're not, why aren't they?
They're not currently counted within the numbers in hospital because they're not receiving hospital level care, and the numbers that I've quoted who are in hospital are people who are receiving hospital care. The residents were moved to Burwood Hospital to assist with their management, but they're not currently categorised as being in hospital. That's something that we may need to look at how we report our numbers.
Fine distinction. I mean, they must be receiving care from hospital staff.
Well, that's certainly something we can look at how we report our figures. But up until this point, we've been very clear that when we say the people who are in hospital, they're in hospital because their clinical condition requires them to be in hospital, and they're receiving hospital level care.
Would there be any consideration of changing the approach to retirement homes given the clusters and the vulnerability of people in those facilities?
I think this highlights that age group is very vulnerable, and aged residential care facilities are very mindful of the risks that are posed to their residents. And what I can tell you that at the Ministry today, we will be in touch with all the district health boards to make sure that they are in contact with their aged residential care facilities to emphasise with them the need to have good policies in place around visitor restrictions. We know that under current level 4 lockdown, those are already very much in place.
The way that these facilities are being managed, do you have any concerns at all that there are things aren't as robust as they should be, particularly in residential, for elderly people?
I'm not aware of any specific concerns for any of these cases, but what we are doing is reminding that the aged residential care of what they should already have in place, and that does include making sure that staff don't come to work if they're sick, that PPE is available for staff, and that good infection prevention control is practiced. Those messages have already been given out to that sector, and we just want to make sure that our DHBs are supporting that sector in actually implementing that.
City
Ramping
Department
up
presentations
PPE
in Auckland
requirements.
and Northland have seen a 50% drop during the lockdown. A GP's seen a similar reduction.
I'm sorry, could you say the beginning of your question again?
ED or emergency department presentations in Auckland and Northland have seen a 50% drop during the lockdown. Are GPs seeing a similar reduction?
I haven't seen any figures for that, but I'm aware that that's what GPs are reporting. And one of the comments that we have been saying during the week is that we don't want people not to seek healthcare during this time because of the concern about COVID-19. We are concerned that there may be people with other health conditions who are not getting the treatment that they need for those conditions, and so we would recommend and advise people to contact their GP if they're not feeling well. COVID-19 is a particular focus, but we really want to make sure that people who need care for other conditions are seeking out that care. We are hearing that there has been a reduction, and we just want to make sure that people are seeking care when they need it.
Be helping doctors by going.
We'll be ramping up requirements for PPE given these deaths have occurred amongst people who are elderly. We've been having calls from people who are older and immune compromised saying that community care workers have been coming to them with no gloves, no masks, and saying that that's because they're still fulfilling their Ministry of Health requirements by not having those things.
Well, we have provided guidance on PPE, and we have a lot of PPE in the country. We're moving that around to the places that need it. We've got more PPE coming in this week. We will have a new distribution system available for our PPE. We really want to make sure that our staff have access to PPE so that not only are they safe, but they feel safe as well. And as we move into this next phase of our response in New Zealand, and we're seeing some of these critical areas where we're still seeing cases, I think aged residential care in particular is highlighted as an area of need, then we do need to make sure that people have access to PPE and that they are using that in the correct manner.
Whether they have access to it or not, if it's not in the Ministry of Health guidelines that they have to wear it, they're not going to wear it. That's what people are telling us. So do the requirements and guidelines need to be strengthened?
The guidelines have been modified over the last couple of weeks, and certainly what we want to emphasise is that people in clinical care, if they wish to use a mask, then they should use a mask. We're not restricting use of PPE. We have provided guidance about the highest risk for using PPE. We want to make sure that PPE is used in those situations, but we're certainly not rationing the use of PPE outside of that. And as I say, the supplies have increased, and so we should be able to support that. Yes.
What more can you tell us about the Wellington death? Is the man from the Wellington region? What were his underlying health conditions?
No, I'm not able to say anything more from a patient privacy perspective.
Are any of those who passed of Māori Pacific descent?
Not that I'm aware of, no.
Any
What more
information?
details
Yes.
can you give on the 2 nurses who were infected at Waikato Hospital? Have the origins of their infection been uncovered? Was it infected at work?
I understand that number is now 3 staff at Waikato District Health Board, and investigations are still ongoing as to the source of the infection. But I understand that the 3 nurses are connected. They have close contact with each other outside of any hospital setting, so further investigations are underway to determine the source there.
What information do you have regarding a death at the Pullman Hotel in Auckland last night, which has been used as a COVID-19 quarantine facility?
I'm not aware of any death that occurred there, but we'll look into that and get back to you. Just, 2 more questions?
We've had a supermarket worker in Flaxmere diagnosed with the virus and was working possibly for a couple of days before the symptoms emerged, I think. Sorry, forgive me, I'm just trying to read here. Have you been able to link any other cases back to this worker?
Yes, so in that particular case, I've spoken to the Medical Officer of Health in Hawke's Bay, and there is a link, there is a household link there, and so that is a case that we do know about. That is not community transmission in Hawke's Bay.
So
one
I
last
know
question.
strictly-
One last question.
Strictly your area, but have you had any general information about breaches or people's behaviour over Easter? Anything in that area?
I'm hearing that on the whole, people have been following the rules. People have heeded the advice to stay home and have a staycation. I know that the police have been out doing road checks and following up calls that there have been to them. But on the whole, I'm hearing that most people are being very compliant and very aware of the need to stay at home at this time. So one last question.
By choosing to not name those Auckland clusters until now, have you missed opportunities for contact tracing?
No, whilst we haven't named them on the website, the work has been ongoing for all of those cases. Every case that gets notified is followed up and their contacts are followed up. And it's only after you follow up each individual case and follow up their contacts that you begin to make the connection that they could be part of a cluster. And then there's a further investigation to try to find out where that source of exposure might have been. Sometimes it's obvious, sometimes it's less obvious, but certainly the management of every single case and their contact follows immediately on notification. Thank you very much.